Hello, guys. This is Dr. Arkoproho Mitro, uh, and welcome to this channel, Khushi Journey Within Mind's Canvas. And I am today. I'm going to talk about a very important topic related with child psychiatry, which is much more prevalent in these days among children, and it requires special attention to each and everyone to know and to be aware of this illness and to avail treatment at its earliest. So, I'm going to talk about ADHD today, that is Attention Deficit Hyperactivity Disorder, which was previously called as Minimal Brain Dysfunction Syndrome. So, in ADHD, that is Attention Deficit Hyperactivity Disorder, you can guess that from the name itself. What are the components of this illness? That is, it progresses as hyperactivity, hyperactivity, impulsiveness or impulsivity, and then attention deficit. That is hyperactivity. It refers that the child is not able to sit at one place, is completely restless, motor restlessness of the child. And then inattentiveness, then impulsiveness, the child is completely impulsive, cannot wait for his turn during, as for example, when the child is playing with his friends in playground, he or she is not waiting, was not able to wait for his or her turn during the when the play is continuing. So that refers to the symptom of impulsivity. And obviously the third thing is attention deficit or inattentiveness, that is, which has a broader impact on his studies and academics. That is, if the child is has decreased attention span, it leads to lack of concentration and also compromised memory functions, which ultimately leads to a poor scholastic performance of the child. So in what we have to diagnose that, what we can say that the child is suffering from ADHD, then we have to say that the symptoms, all the symptoms I have mentioned, hyperactivity, impulsivity, and attention deficit, all the symptoms must be present before the age of 12 years. This is the first thing. And the second point is the symptoms must be present in at least two settings. That is, either it should be home, and it either not, it should be both in home, that's when the child is at home and when the child is studying in the school. Both, in both settings, the symptoms must be present. And also the symptoms must hamper the child's social, educational, that's academic and extracurricular activities to a great extent. So, this is in brief about what ADHD is all about, and it occurs more commonly in males as compared to females. That's male is to female ratio is around 3 is to 1 to 5 is to 1. And also, it mostly happens in the age of school going children. And obviously, there's no exact etiological cause, etiology or etiopathology behind this. It's idiopathic almost, but it can it is on a it is in research it has been studied that uh, dorsolateral prefrontal cortex hypoperfusion or some kind of genetic or psychosocial factors are there, which can help which can lead to the symptoms of ADHD in the child. It can also happen in adults, but it is only the adult remnant. Adult onset ADHD is the only remnant of the child form. It's not some separate entity and all. So we have to treat. How can we treat? By treat ADHD, it's by usually psychotherapy and pharmacotherapy. You can give psychotherapy is like is can you can avail in educational psychotherapy, like family psychotherapy, or individual, only the child psychotherapy, psychoeducation, and to practice the behavioral skills, behavioral mindset and all. It's not very much popular, but what's popular is the pharmacotherapy, that is the management by medicine, by drugs. That is, you can the drug of choice is methylphenidate, that is a CNS stimulant, but only disadvantage, it should be avoided before 6 years of age. And any also some non-stimulant drugs are also available, which can be given, like atomoxetine can be given, bupropion, guanfacine and clonidine. Clonidine is an alpha 2 adrenergic agonist. Atomoxetine is also a drug of choice for ADHD associated with tic disorder, which is a separate psychiatric entity also. So this is all in all, in short, about ADHD, which is a very very important and prevalent disease in the children. In This is a psychiatric illness in children which needs to be managed and which needs to be brought attention to at its earliest to prevent any future complications, any future abnormalities in the child when the child grows up, as it usually happens during the growing phase of the child. So let's spread awareness about this topic, and anyone who is in the family who is having this kind of illness, who is having any child who is suffering from all these symptoms, please come up, please speak about it, please uh, follow the pattern of symptoms, and don't wait for a long period of time. Just come up to us, come up with anything, come up with all the symptoms, all anything you have possible, and let us speak to us, make us aware, and we will help you to solve your problem. So that's all in all, and don't forget to like, share, and subscribe this channel, and let's grow Khushi. Let's help us to increase the canvas of Khushi, increase the span of this channel, Kushi, the journey. Let's the journey through the mind's canvas be continued. And don't forget to like, share, and subscribe this channel. So thank you.